Good afternoon. I'm Donna Emma, one of the co-chairs of the MGH Leadership Council for Psychiatry.
And good afternoon. I'm Patty Ribicoff, co-chair of the Leadership Council. We hope all of you are staying safe and well. Welcome to the first session of the Leadership Council's Visiting Day series. We are excited about today's program and the opportunity to hear directly from the faculty of the Department of Psychiatry about their work during the COVID-19 crisis.
Usually the council would be preparing to host its annual visiting day at the Harvard Club in June. It is one of our two signature events. Members travel to Boston from all parts of the country to attend a day of educational seminars. It's a wonderful occasion to get together with fellow council members and to meet informally with top-notch researchers and clinicians from Mass General Psychiatry. Given our unusual circumstances, this year we're extremely delighted that we gather together virtually. Today's session is the first of four, each with a different topic. We want to express our great appreciation to the MGH faculty who have taken time out of their busy schedules to speak with us today.
And we are so very glad to see council members and friends and supporters of the department with us here today. It is now our pleasure to introduce the Chief of Psychiatry, Dr. Maurizio Fava.
Oops. Thank you so much, Donna and Patty. It's a pleasure to be here. I want to thank you for all the support you're providing to our department and all you're doing. We're very excited to have a fantastic panel today. As you know, COVID-19 has really been a tremendous disruption to our lives. Here is a virus that threatens the lives of our friends, families, communities, our own lives, and clearly there is a mental health toll on healthcare workers, on those who suffer from COVID-19, or those who have family members with COVID-19, and those who are live in fear of contracting this virus. So one of the things that we had to do with COVID-19 is to really convert our department into a virtual department, and in the sense that the traditional visits in the office were no longer feasible. And so we started using video conferencing, Zoom visits as a way of continuing to treat our patients, seeing new patients, to the point that this month we've seen 120% of the patients that we saw last year at the same time. Tremendous work on the part of our clinicians, but also tremendous work on the part of the people that you're going to hear from today in trying to help healthcare workers deal with the stress of COVID-19, helping patients, communities. And so we're going to hear from them. So let me tell you a little bit about our panelists today. We're very fortunate to have Dr. Jordan Smoller, who's the Associate Chief for Psychiatry of Psychiatry for Research at Mass General, Professor of Psychiatry at Harvard Medical School and of Epidemiology at the Harvard School of Public Health, and Director of the Psychiatric and Neurodevelopmental Genetics Unit. Dr. Eugene Beresin, who's the Executive Director of the Clay Center for Young Healthy Minds and Professor of Psychiatry at Harvard Medical School. Daphne Holt, Co-Director of the MGH Schizophrenia Clinical Research Program and Director of the Resilience and Prevention Program at Mass General, as well as Associate Professor of Psychiatry at Harvard Medical School. Louisa Sylvia is the Associate Director of the Dalton Family Center for Bipolar Treatment Innovation at Mass General, and Director of the Health and Wellness at the MGH Home Base Program, as well as Associate Professor of Harvard Medical School. And finally, Luana Marques, Director of the MGH Community Psychiatry Program for Research in the implementation and dissemination of evidence-based treatment, or PRIDE program, Associate Director of the and Director of Research for the Center for Anxiety and Traumatic Stress Disorders program, or CATS-D at MGH, and Associate Professor of Psychiatry at Harvard Medical School. The format of today's program will be kind of a panel a discussion, and then the last part will be an open Q&A moderator by my friend and colleague Lee Cohen, who's Associate Chief of Psychiatry for Philanthropy and Departmental Communications. So let me start with Dr. Smoller. Jordan, the department knew from the outset that patients and healthcare workers needed resources to help them cope. And you and your colleague and postdoc, Dr. Carmel Choi, have done an amazing job compiling, updating the Mass General Psychiatry Guide to Mental Health Resources. It's an extraordinary and extensive list available to anyone in need. What gave you the idea to create this guide?
Well, thanks, Maurizio. And first of all, let me just say it's a total pleasure and honor to be part of this today. You're absolutely right. I think that one of the things that was inspiring about how the department responded was this kind of immediate recognition of the urgency and gravity of what we were facing. Clearly, many of the things that we rely on for mental health, including social connection and access to care and all of these things, and valuable information, were under threat. And so we recognized that there were two things that we might be able to make a difference in fairly quickly. One of them was, with this flurry of information that's very difficult to evaluate, there are many helpful things out there, having a curated central source for all kinds of really high quality information that can help people to manage stress, to find help, and to have tools that they can use on their own. And the other was to do that in a way that could reach a lot of people, because people were worried about how they connect to these things. So within a couple of weeks, really, we had stood up, we sort of started it organically, and then we stood up a website through the help of Dr. Fava and the department, establishing that on the main MGH website. One of the things that was extraordinary about this effort that, as you mentioned, my postdoc Carmel Choi and I helped to lead, but really it was a team effort from the entire department. The generosity, the collaboration, the suggestion for resources that could be made available was really remarkable. And I think maybe it's best to just show you for a moment what this looks like. So I'm going to share my screen. And if you get to this, if you went to the website, this is the, can you see that? Everybody see that?
Yes, we can see that, Jordan.
Good. Okay, so you would come to this guide for mental health resources for COVID-19, and there's an introduction for how to use this guide. And then what we did was provide resources that we catalog in various formats or various domains. So general mental health and coping, specific mental health conditions for folks who have pre-existing conditions, families and children, healthcare providers, military families and veterans, mindfulness and other tools, and a separate section that's login only for partners employees for some of the resources, some of which you'll hear about momentarily. And so then if you, for example, went to the families and children part, on each of these pages, you get a sort of how to use guide. And this tells you the how we've annotated some of these resources with a star for things that we think are particularly noteworthy. We've also, thanks to help within the department, launched the Spanish translation website version of this. And for each of these, we have different domains. And then we've pulled out what are the key points that we think are particularly helpful, but we have links to the original materials here. And so you can see at your leisure, if you want to take a look at the site, one of the things you'll notice is how much homegrown expertise we have. The Clay Center, you'll hear from Dr. Beresin, the Family Dinner Project, and many other things that were really started and pioneered here in our department. And then one other thing I'll just highlight are these mindfulness and other tools. Again, you'll hear more about this in the course of this afternoon, but specific apps that are free to use and that have been, that we have recommended for people to take a look at on healthy habits, mindfulness, as well as things that you can do to stay active, yoga movement. There are videos. Many of the people who are on the panel today have provided video material and lectures and podcasts. So I encourage everybody to use it. It was really just a remarkable team effort from the department. It's now, it's curated on an ongoing basis, updated almost daily. And it's been used by more than 50,000 people around the country and around the world so far. So we're really happy to have been able to contribute in that way.
Well, thank you so much, Jordan. That was a fantastic. If you have any questions for Jordan's presentation, please use the chat function to ask questions. And at the end, when we have the Q&A with Lee Cohen, we're going to use those questions. So let me move on to Jean Beresin. Jean, the Clay Center is an amazing resource for the public through his website and social media. It's really been a great resource for kids and families, even before COVID-19. But COVID-19 in some ways really kind of catalyzed tremendous interest in how to talk to your kids, how to explain to them that you have to wear masks or practice physical distancing. How can we support kids and teens during this pandemic?
Thanks, Maurizio. I'm delighted to be here. Let me begin by saying what parents can do and caregivers can do for all kids, and then separate it by toddlers, school age, and then teenagers. So all kids want to know 3 questions. Am I safe? Are you the people caring for me safe? And how is this going to affect my daily life? And all kids need a number of things from their parents. So for one thing, you've got to control your anxiety, because anxiety is contagious, and all the research has shown that when parents are calm and their anxiety is controlled, they can convey information far better. Begin by asking the kids what they know. I mean, don't assume that you know what the kids have heard about. Many school-age kids and teenagers have used smartphones and digital media. Some have good information, and they may have some questions that are realistic, and some are really quite unrealistic, like they're worried about their dog getting sick. Well, we know that animals don't get the COVID virus. So we can answer their questions when we know what they're worried about. Validate their feelings and their concerns, no matter what they are, because they're all important. Be available, because this is not going to be the first time that you're going to have conversations with them. Empower and model behavior. So, for example, wash your hands with your younger children and sing happy birthday twice. That's 20 seconds. And wear masks. And when you go outside, be sure to put your masks on so that you can model things for your kids. I would provide them reassurance. Kids of all ages need structure and guidance. I mean, it's one of the problems that we have of being at home, and we're all doing different things, but we all need structure. And try not to blame others for this illness. I mean, this is something that we're all struggling with. Now, toddlers and school-age kids and adolescents need different things. Toddlers react more to the emotions of their parents than actually discussions and explanations. So be available to them emotionally. They need a little more TLC. They may need to sleep in the bedroom with you at night. And for toddlers, turn off the media. What they hear, they won't understand, and especially conversations that you may have at home, just not let them be a part of that. School-age kids, they need structure. They think in black and white terms. They want simple explanations. They also thrive with routine and structure, and they work things out with play. And school-age kids may regress. They may become a little bit more clingy, so expect that kind of regression. Teenagers, on the other hand, they're more capable of understanding the nuances, conceptual things that are going on. And for them, I would watch the news with them and discuss things as they're going along so that you can answer them in real time, and you can help them participate and contribute to the family, because it's really helpful for them to be a part of the solution and not a part of the problem.
Thank you so much, Gene. That was great. So at this point, I'd like to ask, Daphne Holt, who's the leading expert in resiliency, and prevention, the notion of building skills to be able to face adversity and to bounce back from difficult times is really critical at this time. So how can we build it during the trauma of physical isolation, uncertainty? How can we help ourselves or our frontline healthcare workers become more resilient?
Yeah, great. Well, I am so delighted to be here. It's so great to be in this illustrious panel. And yes, no, it's such an important time for us to be thinking about, our resilience, both for ourselves and the people around us. And there are small things that you can do. Greater resilience can come from just doing things for even really short periods of time that increase feelings of well-being, specifically for you, because everybody is different. So whether it's being in nature or connecting with other people, some people prefer to have, more alone time, meditating, spiritual practices. These are all things that, if we can identify the things that help us individually be more sort of resilient, that we can try to practice. And, this probably seems in some ways like common sense, but, we all are so busy, and, people really have to make, and sometimes a really conscious effort to do these sorts of things. So, to make the time, you do really have to be convinced that it might make a difference. I know that I feel that way. But we know from a lot of research that people's resilience is not a fixed quality. You're not just born with a level of resilience that can't change. We actually can change our resilience by doing certain things, which you're going to hear more about from Dr. Sylvia and others. But, it's also really important to be clear that feeling anxious or sad or stressed out during this time is like completely normal. And these feelings don't necessarily need to be gotten rid of or somehow fixed. Part of being resilient is actually acknowledging, when things are really difficult. So as Maurizio mentioned, we have been conducting a study. We've developed this program. There have been 3 groups, including one led by Louisa Sylvia, who you'll be hearing from in a minute, and another led by Elise Park of the Benson Henry Institute. This program that's dedicated to providing online resilience tools to healthcare workers. One thing that we have learned is that although healthcare workers are clearly in an exceptional situation, given the tremendous risks they're exposed to and the extraordinary demands that have been placed on them during the pandemic, they are also dealing with some of the same concerns that we all are struggling with. So to illustrate this, I'm just going to play a short clip of a nurse that we interviewed for this project. Actually, I need to share my screen first. Let me just do that.
Dealing with this COVID-19 has been scary for all of us. We're all worrying about a lot of things.
I think we can't see the video. So
oh, sorry. Okay, hold on. Can you see it now?
Dealing with this COVID-19 has been scary for all of us. We're all worrying about a lot of things because we don't know what's going to happen. It's the unknown that scares us all so much. If we just knew, then we could process and deal with it and handle it. But not knowing is what makes us all worry.
So, you know, I think we're all struggling with the many uncertainties about the future. And, you know, one way to manage the distress associated with uncertainty is to practice keeping our minds focused on the present. So in the program I mentioned, we're offering frontline healthcare workers these online courses that focus on teaching techniques such as mindfulness and compassion practices that have been shown to increase resilience. We developed these for MGH employees, but these techniques can be used by anyone during this crisis or during any time of increased stress. And I just want to mention one interesting thing we've learned from the surveys we collected from the participants of this program. Healthcare workers who feel that they're positively impacting people through their work have fewer symptoms of depression and anxiety. And this is particularly true for those who are treating COVID positive patients. So I think we can perhaps, you know, sort of extrapolate from this finding to our own lives to some extent, since we can all have some sort of impact during this crisis. And even small contributions like calling up a friend who's isolated, helping out a local small business, you know, even just the mere act of wearing a mask, all of these things can help us feel more empowered and resilient during this time.
Thank you so much, Daphne. We're going to move on to Louisa Sylvia. Louisa, you've developed with your colleagues at the Dalton Center a mindfulness wellness series that teaches basic mindfulness skills and has been extraordinarily successful. Can you tell us how mindfulness can help people cope during this time? Can you give us a sense of how it works?
Sure. So again, thank you for having me here. It's great to have the opportunity to speak with you all. It's a great question, and Darcy cues this question up perfectly because she really speaks to the main issue here about not knowing the future. And as Daphne Holt sort of already mentioned, the core to mindfulness is being in the moment. I always tell people trying to debate the future is probably not a business you want to get into because we can't predict the future. We don't know what's going to happen in the future, but we do know what's going on right now in this present moment. And that is something that we can control right now. And so, for instance, if we were working with Darcy and applying mindfulness to Darcy's situation, we'd really try to encourage her to focus on her thoughts and feelings and sort of physiological sensations in the present moment, because that is something that we can actually do. So with that in mind, we went out to develop a couple of specific mindfulness programs for COVID. So we recently completed a large mindfulness-based study with 5,000 people around an 8-session mindfulness-based cognitive therapy program and got great results in terms of improving anxiety and depression and stress coping and overall well-being. So we adapted that program specifically very quickly with examples specific to frontline clinicians. So for instance, we talk about how to practice mindfulness in difficult situations. So we talked about working back-to-back shifts, working longer hours, sleep deprivation, not being able to see your family, having to isolate from your family, fear of infecting your family, or fear of getting sick and bringing that home. So we brought all those examples into our 8-session MBCT program, which has currently been rolled out all across Partners Healthcare and was even asked to be put on some state websites here in Massachusetts, which is great. And we're not collecting a lot of data through that. We really just kind of made that a public resource for everybody out there. But as Daphne mentioned, we are also piloting another mindfulness-based program. This program is actually doing virtual groups. So the other program is just an asynchronous online program that you can click and go into and practice the 8 sessions on your own time. This other program is actually you sign up for a virtual group, and we actually put each specialty area into one group. So if you were a nurse, you'd be paired up in a group with other nurses. If you were a physician or a physician assistant, you'd be in a physician-specific group. We offer them at 6 in the morning, 8 o'clock at night, and times that we thought people could make. And we actually got some great feedback and participation in these groups. So to date, we've had over 100 people enroll in these various groups. And this program, I should mention, is based off of, as Daphne mentioned, Elise Park's mindfulness-based program. It's called the SMART program, or the Stress Management and Resilience Training Program. And it's, again, based on mindfulness. And we found that we've only got about 32 people or so that have completed the entire program, the full 8 sessions, but again, we've been seeing some very positive results. Specifically, people are feeling less anxious, less lonely and isolated, which is really important, feeling more able to cope with stress, and an outcome that we're really proud of as a mindfulness-based program, they're being able to focus on the present moment more. So that's exactly what we're sort of aiming to do to help people like Darcy sort of be in the present moment and again, control something that they feel like they can in the moment. So that's where we are today, and we're continuing to roll out these groups, and we'll have more data and learn more in the future.
Thank you so much, Louisa. We're now going to move on to Luana Marques. Luana, you've been absolutely passionate and committed to helping underserved communities and increasing their access to mental health services with your PRIDE program. During this pandemic, Latinos and African Americans are experiencing higher rates of cases, hospitalizations, and death. Could you speak to the challenges facing underserved communities hard hit by COVID-19, and what should we be doing to help increase access to mental health services in neighborhoods of those who are underserved?
Thank you, Maurizio, and thank you everybody for being here. I hope you and your family are well and staying safe. So Maurizio, the first part of your question is really what are we seeing in our communities? And when I think about that, I think about growing up in Brazil and growing up poor and thinking about what it took my mom to hold jobs just to feed us. And that's really what we're seeing in our communities. We're seeing food insecurities, housing insecurities, the inability to get diapers for their kids. And so our communities are really, really struggling. And with that, there is definitely an increase in mental health need, and access is definitely an issue. When I think about access to care, I think broadly, not just our communities. Pre-COVID-19, 20% of the US population needed mental health care at one point or another. And yet only 0.1% are trained to deliver it. So I really think that the only way to increase access and really to have mental health for all is to reinvent how we think about therapy in general. And I think my esteemed colleagues here have been talking about building resilience with skills, and cognitive behavioral therapy is really skills, not therapy. And so we really need to think about how to deliver those skills in our communities by perhaps training non-licensed professionals to do that. And our lab here has demonstrated that's not only feasible, that is something that we can do with efficacy and fidelity. That's why we're launching a training institute to really bring mental health for all. And for anybody that's interested, we're actually releasing a course that has CBT skills, not therapy, that's going to be available in many languages so we can reach our communities globally. It's been supported by Philanthropy, and it'll be released by the end of June. So I invite you to share that with your network.
Well, thank you so much. Just a question for you, but also for Daphne and also for Louisa. What are your personal coping strategies at this time? Because everybody wants to know, you guys are the expert. What should we be doing? So what are you doing to cope?
So, I mean, for me, I'll take a stab and then I'll let them take. I've been thinking about this in a couple of ways. First, that it's okay not to be okay, that we're under chronic stress and that all of us are going to have some activation in our limbic system, our emotional part of our brain. And so it's really important to watch for it and then to cool off your brain. And the three things that I think are important is really to sort of unplug a little bit from the news and try to anchor on things like meditation or mindfulness. I think it's important to charge up. Eating, sleeping, and exercise are not optional right now. They're shown to decrease depression, to increase well-being. So we really need to be charging up our bodies. And then finally, I think we need to really be of service and connect with others. And I think those are the things that I try to remind myself to do the best I can, knowing that's still okay not to be okay, that it's a really difficult time. So we're getting close to it. But that's what I've been practicing.
Well, a great suggestion. Certainly as an Italian, charging through food sounds very good to me. So let me ask Daphne and Louisa, how are you guys, what are your coping strategies at this time?
Yeah, well, I think everything Luana said makes total sense. I would say that because I am such a, we all are so busy. I really need to trick myself sometimes into doing the things that, I'm not naturally inclined towards mindfulness practice or those things. So I have this little trick in my mind now that I have to take a walk to the river. So I have just a one word, like river, water. I can, I live in Cambridge. So if I go to the river and back, it always makes me feel good. And I also am a big fan, and again, I don't always remember to do this, but I think like really small little acts of, generosity or contributions have sort of helped me. There are a bunch of small businesses really near where I live. There's a pizza place that I love, and I know they're really struggling because most of their business comes from the high school that's right across the street, which is closed. So I've been trying to go there, and I, gave them a little bit of extra money once and all that, that kind of stuff. Today I sent an email to someone I know who lives alone, just little things like that, I think make me feel a little bit like I'm contributing, which I think, is sort of helpful.
Thank you so much, Daphne. Louisa, how about you?
I'm happy to chime in here. I'll add a few extra little skills. So little things that I like are, for instance, the acronym MEDS. Maybe people have heard this. Sometimes the M stands for medications. I like to have it stand for mindfulness. So you have mindfulness, exercise, diet, and sleep. Some really kind of core things. I call that sort of the building blocks to wellness. If you don't have those things, it can be really hard to meditate, for instance, to do a guided imagery, to do breath awareness. So it's really, those are sort of some crucial things, as my other colleagues have mentioned. Two other things that I like that we haven't talked much about. One, mindfulness talks a lot about building self-compassion for yourself. And Luana kind of mentioned this, but this concept of don't beat yourself up. Whatever you're doing right now is probably better than you think it is, and probably pretty good. So kind of keeping that attitude of I'm doing the best that I can and finding ways to sort of be kinder to yourself. And one way that I like to sort of stay on that sort of positive mindset is to do 3 appreciations every day. So what are 3 things, despite the fact that you might be stuck at home and or juggling a lot of different things, what are 3 things today? It could be making a cup of coffee, or the weather is nice out today, or as Daphne said, doing something nice for somebody else. But what are 3 things that you appreciate out of that day to kind of try and focus again on the present moment, which is the core of mindfulness, but also to focus on sort of the positive of the present moment and bring that into your awareness.
Well, thank you so much, Louisa. These are all great suggestions, great, but let me ask Jean Beresin, because, Jean, you said as a parent, the first thing, try to be calm. Now, wait a minute. That sounds so easy. So, how do you look calm with your kids when maybe inside you're apprehensive? And also, how do you really communicate? Sometimes kids fear for the safety of their parents. Will I lose my parents through this? How do you navigate that? And by the way, we have these amazing experts today. Feel free to use the chat function to pose any questions that we'll use for the Q&A with Lee Cohen. So please feel free to use that function. So Jean, what are your thoughts about my question?
Well, first of all, parents, to control their anxiety, I think they need to use some of the techniques that we've just heard about. Getting information that's accurate, but not too much information, and flooding yourselves. Talking with others. I mean, one of the things that Jordan has studied, which is, and we all know about, is making connections with others and making contact and attachment with others that we love. This is a time that we need to use digital media. Use FaceTime, talk with your family, talk with your members of your spiritual community, be in contact with others, because that helps control and contain your anxiety. Obviously, meditation, sleep, diet, exercise are important for everybody, but other things that parents can do: carve out time for yourself, use structure for yourself, be honest with your kids. Kids will pick up if you're anxious or worried. There's no harm. I mean, I'm not talking about toddlers. I'm talking about school-age kids and adolescents. If you say to them, yes, I'm worried and I'm upset, but we've been through hard times. One of the things that one of the reasons we read stories to kids, bedtime stories, and is they love narratives. And I would remind them, and remind yourself, that we've been through hard times. Remember when the hurricane struck. Remember when we lost power. Remember when, grandma died. Remember how we dealt with that. Remember that we've been through tough times, and we've gotten through it. Narratives and stories are very, very important, and they're reassuring. I mean, there's no doubt that spiritual communities all over the world use narratives to help convey meaning and understanding and compassion. And I think that telling kids stories that are honest and not being dishonest about it. If you're anxious, of course we're all anxious, but we can do something about this together. So, I'd be honest with them, and I would relate the stories that would help reassure us and help reassure them.
Well, thank you, Gene. I have a question for Jordan. Your MGH guide is really an amazing kind of source of information and guidance on what to do, leveraging kind of digital resources. Have you noticed that since the beginning, in some ways, the information has changed, and in some ways you had to adapt your guide to, what was happening? Have you noticed any trend, if you wish? You have to unmute yourself.
I always fall for that. One of the things that has happened, I think, that over time there's been sort of a greater recognition of the various, the sort of very broad impact this has had on many different folks. I mean, if you think about it, there are lots of communities or individuals that we might worry about because of different aspects of this, because of, there are the fears and the dealing with the illness itself, or the loss that goes with some of the, actual deaths from the illness. There are the healthcare workers that we talked about. There are the children and families that we talked about. There is also, of course, all this secondary impact of the financial and socioeconomic devastation, and Luana alluded to that in many of our communities. And so one of the things that we have seen, and I've been grateful for people contributing, are these kinds of additional resources that really can help specific groups of people and meet them where they are in terms of the particular stresses that they're under. I think we're at the beginning of, first of all, learning at what the impact of this is in all its different ramifications. But it's been impressive how quickly things have moved, and many of the people, Luana and others on this panel, have moved so quickly and been kind of a national voice for doing that urgently.
So Jordan, I know it's a little bit off topic, but you're providing very, curated, very, thoughtful and helpful information about mental health. But there are also things that, people want to know about the illness itself. Like, for example, Gene mentioned dogs don't catch COVID-19. Well, but cats may. And, where do I find out this, this information? If I have a dog and I shouldn't really worry about it, but I'm worrying because I don't know that dogs seem to be relatively immune from it. So where do we find information about the illness? If I'm wearing a mask, am I protected? Or those kinds of practical information, where do I find it?
Yeah, I think that for me, the two sources that I go to, although, these have, controversy has been injected in this whole area, but the CDC and the WHO are sources where vetted information, scientific expertise from the NIH and the CDC come together. Those would be the first stops that I would recommend to people. So the cdc.gov and the WHO website for information about the illness itself.
Thank you so much, Jordan. Now, this is a question for Daphne, Louisa, and for Luana, because you're you're clearly kind of building resilience, helping coping. But, there are people who have experienced the COVID-19 pandemic while suffering from depression or from anxiety disorders. And they've seen, in some cases, worsenings of their condition. So how can we deal with the impact of COVID-19 on those who suffer already from conditions of anxiety and depression?
Maurizio, I've been talking to my patients a lot about the added stress, what's doing to their brain. I'm suggesting they talk to their psychiatrist to make sure their medication is the best possible. But also I'm reminding them that practicing the things that we're talking about here may not feel fantastic because they really had a vulnerability before, but if you don't practice them, then you're likely gonna get worse. And so really it's sort of riding a wave and feels more like a tsunami, but that we're riding that together and that we're here to support them.
Thank you. Daphne, those who, for example, have, conditions like schizophrenia or, they must be going through a very difficult time. So how can we help them?
Yeah, well, I think, just staying in close contact with our patients is so important during this time. I mean, as Luana said, like the idea that this is a huge stressor for everyone, but of course, even more so for people who are already sort of, isolated, marginalized in various ways, already maybe a little bit disconnected, but sort of emphasizing that this is temporary. And, also realizing that different patients are responding to this differently. For some patients, the social distancing has been sort of validating in a way. There's been sort of a heterogeneity in terms of how people react. In some ways, some people I have worked with are a little bit nervous about when it comes back to normal, because there's something sort of helpful about everyone being in the same boat, so it's interesting. But yeah, I think just maintaining a steady, consistent presence in our patients' lives is really important right now.
And Louisa, your work at the Dalton Center, sometimes people who suffer from bipolar illness are in total denial of the illness, but also become very risk takers, impulsive. They may say, "Oh, I don't need the mask," or "I do." How do you manage that?
Oh, it's a great question. Someone pops into my head right as you're saying that. Someone who actually was very depressed at the start of the pandemic and then very rapidly switched into an elevated mood episode and started to engage in some of those riskier behaviors. So going for walks without wearing, and lives in a sort of fairly busy space and wasn't wearing a mask, and was aware enough to know that people were sort of not pleased that this person wasn't wearing a mask and giving him dirty looks, but sort of like, not seeing the consequences not only of that behavior on others, but also potentially for himself and how he was opening himself up possibly to greater risk. And so I think that's, and getting back to what some other folks have been saying in regards to, watching television and watching the news may not be the best place for some of those people to build their insight. And so that becomes challenging, right? Because the news has been, especially in the beginning, was so focused on some of the negative aspects of the pandemic that was actually really damaging to people who already had challenges with sort of positive thinking and adaptive thinking. And so trying to find some of these outlets that Jordan talked about that are more scientifically based that people could go to get information to help educate them to build their insight and awareness is crucial. And then ultimately just trying to bring in awareness with other people that love them and who are around them who can give them the feedback as well. But it's certainly a challenge, and it's not any different now than it would be, for instance, without the pandemic. We're still using some of the same skills and the same thoughts, but just the consequences, I think, of that risk-taking behavior could be greater potentially.
Thank you so much, Louisa. Now I'm going to pass the baton to my friend and colleague Lee Cohen, who's going to moderate the Q&A. I know we have lots of questions in the queue. So Lee, take it from here. Lee, you have to unmute yourself.
Hey, terrific. Thank you, Maurizio. And I really just want to say, listening to my colleagues this afternoon, it really speaks to the extraordinary work that's being done across our department. So much of what Daphne and Louisa and Luana sort of described, and Jordan, your work has been done sort of on the fly, and on the fly when the backdrop is a pandemic. It's really been a privilege to watch, and I say that sincerely. I also want to thank the folks who decided to take time out of their Friday afternoon to join us. And so I want to remind people to please use the chat function. I'm going to be moderating some questions. Some have come in. They're terrific questions. And so Daphne or Louisa, sort of a question comes in about, and it sort of dovetails a little bit with Jordan's comments about the task of trying to sift through what's available. And so someone asked about, the different mindfulness apps that are available, and do we have a preference for one? In fact, there was sort of a funny note, Louisa, during your remarks, someone said, I actually witnessed some people having an argument about which was the best app to use. The person thought that was sort of ironic that they'd be having like a heated discussion about who had the best app. So, but practically, I'm curious, you all, because you're doing this every day, whether it be at home or with patients or with our colleagues in the hospital on the front line, is there sort of a go-to app that you think is easy to use?
So I think I can jump on this for sure. I'm sure people have heard of Headspace and Calm, which are two of my favorites. The reason that I really like those is because they also include positive thinking as well, in addition to the guided imageries. And they also have a lot of free material. But I believe, Jordan, you have a list, I think, of some vetted apps, because there are a lot, and they kind of depend on you and your style and what you like. And do you like certain voices or female voices or male voices, or what kind of music do you like? So I always encourage people to try different ones and not to give up if they just try one and don't like it. Those are my two favorites, but I think Jordan has a good list on his website.
And I would also add, the evidence is that a lot of people, like those apps that Louisa mentioned, are wonderful, but the evidence is that people start to use apps and then there's a huge drop off. It's really hard to maintain the use of apps for whatever reason. So it seems like the key is to be doing it in conjunction with, your therapist or, somebody else, maybe, do it with a friend or something like that. I think some kind of like real person, real live interaction, with the app makes it more sustainable, I think.
Terrific. What I'm hearing from you all, it really is, it's not one-stop shopping. There is not best app or there is not a best intervention, and that people come to this experience of the pandemic with very different histories, and I think it's so not one size fits all, and people have to sort of find out what works for them. Jean, there was a question for you, one about something that gets spoken about when we're not in a pandemic, but is particularly relevant, about screen time with adolescents. And someone wrote in that, on certain parts of the day, families, particularly with two career couples, were using screen time in a way to manage the household because that was what they had to do. On the other hand, at the extreme, people, their children were online and, really having a lot of screen time. And so where's the balance, and how do you counsel families particularly during this time?
I think it's a great question. First of all, I think everybody needs, and the families need to create a structure. So for example, structuring the day, there are 168 hours in the week, and now we have so much time at home, everybody is super busy. So one thing that I would do is I would have family discussions about the use of screen time. I think this is not the time really to limit it that much, because it's so important for us to stay connected, with our family members, with our grandparents, with our partners, with our spiritual communities. And for teenagers especially, staying connected with each other is really important. I would be much more liberal about it. One thing I would help them do is I would turn off the blue light at nighttime, because that way it's not going to interfere with their sleep. But there are group activities, so screen time can be structured. And I would discuss with the teenagers, what are you using the screen time for? Are you playing Dungeons and Dragons? Are you watching videos together? Are you creating music playlists together? I would try to make it innovative, creative, and as educational and connected as possible.
It's great. It's practical. It makes sense. And so just another one for you, Gene, just why, because you're on a roll. My child was annoyed and ran out of the house and went over to his friends. And I came back to the house. Should we have insisted that he do quarantine?
Look, the first thing you do when a kid is impulsive and runs out of the house, I mean, first of all, we need to understand why this kid ran out and why this kid did that. Second of all, we need to know, this is like tracing. Who were you in touch with? How much time did you spend? How close were you? What did the parents do? Get some information first before you kind of say you're going to be quarantined for 14 days, and then where and when. I think it's more important. I mean, look, the kid's may or may not have been exposed, but what's more important is to understand what drove the kid out of the house, why the kid ran, the fact that the kid was potentially putting everybody at risk and in danger, and having a discussion about that so that it won't happen again. And if you want to run out, come to us first, and let's understand this first before we start imposing a quarantine.
Great, thanks, Gene. Jordan, a question for you. Someone wrote in, someone who had been on the MGH guide to psychiatric services during COVID. It's an enormous resource. It's user-friendly, but someone asked, actually dovetails a little bit with Maurizio's question, which is how to navigate the amount of information that's coming at people, day in, day out, whether it be through the media. Maurizio asked about sort of the sort of lack of consistency to some extent about medical issues, but even in terms of psychiatric issues, how does the sort of average person day to day, as they're sort of being faced with that, how do they navigate that and frankly stay settled, because frankly so much of it is conflicting?
Yeah, it is a real challenge. And I think part of the answer relates to two of the things that you heard from other panelists. One from Gene about structure, in a sense, and the other from Luana about sort of, setting, related to that, sort of setting some limits and boundaries around things, because it is overwhelming. There's just no way, even if you wanted to assimilate all the information that's out there. It's one of the reasons that we did really want to have a website, at least for resources. It doesn't cover, though, the issues about, the rapid news cycle and how to assimilate all the things that are happening at a government level and in your community, and the rules about, what is and is not permitted. I mean, I think my sense is, the folks that you know and trust and have always known and trusted, whether that's your physician or your clergy person, or those are places to start, I think, because you have a relationship and you have a sense of, if you have a question, somebody to turn to. There are some, fairly vetted sources that I mentioned before about information about the illness. They also have information about mental health impacts. And I think you just have to kind of accept that you're not gonna, you have to set your own limits and not aspire to keep up with everything. And in fact, probably turn down some of the volume on it so that you're not overwhelmed. It's very, stirs you up. And I think that happens for all of us.
Hey, thanks so much, Jordan. Hey, Maurizio, a question for you. And it's sort of dovetailed with comments by both Daphne and Louisa and Luana. But we spoke during this period about some of the interventions that have been developed in real time. Resources are available that we can learn in terms of managing symptoms during this crisis. Someone wrote in, what about when the resilience interventions don't work, or healthcare work with anxiety is still, a person wrote, is still anxious? How has MGH responded to see that these patients are getting adequate care? I wonder if you could talk in terms of the department, sort of what we're doing when our first pass with some of these interventions are exceeded and a patient is experiencing symptoms that really require psychiatric assessment somewhat urgently.
Yeah, no, we certainly have set up a system with very rapid turnaround that really tries to address all these kind of needs that have emerged in the context of the stress and the threat of COVID-19. So we provide virtual assessments, and in those cases where there may be a need of medicines, we can prescribe them, virtually. I don't like this term of virtual, because virtual work, it looks like it's not real work. It is real work. It's just that these virtual visits allow us to prescribe. And one of the nice things that we've actually seen is with COVID-19 is that the usual bureaucratic impediments to prescribing to people of other states, now they've been removed during the pandemic. So I can prescribe to people in Chicago or California, et cetera. So it's so that has made it very, very flexible. But I think that at the end of the day, we're going to tailor the treatment to what is best for the individual, and that's going to be critical. There'll be some people that say, "Doc, I don't want apps. Is there something that I can take that can make me feel better?" Well, I think that in those instances, finding a medication that can actually help can be absolutely critical.
Thanks so much, Maurizio. Daphne, a question for you, and then I may also ask Jean to respond. Someone writes in about this generation, this group of people who are graduating from college. I mean, you can just who were going, last week, the last couple of weeks, the weeks coming now, having these virtual graduations, and they are being thrust into a world that they could sort of never imagine, and confronting issues that are frankly unique with a lot of question marks. And given your work in terms of with college-aged young people, could you speak a little bit about those challenges and sort of how you conceptually think about how they're going to meet those challenges, the difficulties they're going to have, and also how we can support them?
Yeah, no, that's a great question. College students, and Jean can speak more about younger kids, and they've been sort of removed from this sort of trajectory of development, both in terms of their education and their social development, and they're sort of thinking about the future. I mean, college students are sort of immersed in all sorts of those kinds of plans, and suddenly all of that is completely up in the air, and so they're under a tremendous stress and sort of being removed at the same time from all the people who are supposed to be in place to help them with that developmental process, with those tasks of transitioning into adulthood, removed from their professors, from their other friends, all of that. So I think there are enormous challenges for that age group, and you know, just to kind of tie back to the question that was before, that Maurizio was addressing, this whole question of, you know, we're providing certain things, you know, these resilience skills, either an online course or maybe a brief, you know, live intervention via Zoom. But obviously these are kind of short and, you know, kind of preventative, and perhaps, you know, they'll help some people, but then there are some people who are clearly going to need more. And I think this is the same for college age kids. Like, some of them will bounce back after this is kind of, after we get to sort of the new normal. But some of them won't, you know, and so we really need to be thinking hard. And we, you know, I think all of our groups are kind of brainstorming about what we're going to do for those that have kind of persistent difficulties, even when things kind of start returning, you know, a little bit to the way they were. It's not going to be so easy for some people. So, yeah, I think there's a lot to do.
So yeah,
Thanks, Daphne.
just to chime in on that, I mean, let's look upon this as kind of grief and loss. I mean, the college kids, as well as, you know, high school students, have lost a lot. They've lost graduation, they've lost sporting events, they've lost concerts, they've lost hanging out together, and there's anticipatory grief. They're grieving about the future, about not having a summer job or an internship, or not knowing if next semester is going to begin. So we have to help them deal with grief and with loss. And there are plenty of ways of doing that. We can't solve the problem. We can't predict the future, as has been mentioned, but they can stay connected with each other. They can have online activities. They can learn new skills. They can express themselves through the arts. I mean, I can't tell you how many college students and high school students that I have now that are taking guitar lessons, that are learning Zumba, that are kind of, that are interacting with each other, that are doing yoga together online, and that are commiserating with each other and brainstorming together. The other thing that's really important for adolescents and young adults is to contribute. After 9/11, it was so important for high school kids and college students to actually make a contribution, whether it was poetry or artwork or chipping in or going around and making food for neighbors. Then they can feel a part of something and feel empowered rather than disabled and paralyzed. And I think giving them stuff to do or together is very empowering.
Hey, Gene, thank you so much. Jordan, there's a question here, and I'm going to sort of ask you to put your hat on as Associate Chief of Research. There's a question about sort of what is MGH Psychiatry doing to understand about sort of the impact of this pandemic on sort of longer term well-being and actually risk for psychiatric disorder. And so could you speak just a little bit about, on the research side, you know, what's going on within the department and also perhaps even in the field?
Sure. This is, you know, as you might imagine, become the field has sort of pivoted to make this a centerpiece of so much effort. And you know, we've seen this, I think, across the scientific enterprise, where all of the smartest minds and institutions and everything have trained their sights on this problem, and mental health is no exception. So in our own department, there is tremendous activity, including some of the things that you heard about today, the interventions that are actually being studied to determine what's the most effective and cost-effective and accessible intervention, and because these things will not be, you know, over in the next couple of months. So our department is immediately trying to determine what's an effective intervention that we can introduce at scale and gather those data. On a population basis, many of us are involved in large studies looking at the kind of epidemiology of the mental health impacts of this crisis, and looking at, for example, what are the rates of depression and anxiety that result? Is there going to be a peak or crisis in suicide that many are fearing with disconnection and so on? There are studies going on that are looking at child development, including a birth cohort that is active in our department, looking at what's the effect of the stress and perhaps even infection early in life. it's remarkable how mobilized people have been. Even at the level of genetics, people are looking at genetic basis of outcomes and response. So it's really activated and energized a lot of research efforts across the department.
Thanks, Jordan. Luana, a question for you. During your someone wrote in during your Dr. Marques remarked about internet-driven use of like cognitive behavioral therapy, digital platforms that are available where people will be able to go to learn CBT skills. And the question was about access, because I know about your work, and you spoke a little bit about your work, and Maurizio did in your introduction, in underserved communities. What sort of access do people who are clearly affected by this pandemic in underserved communities, what kind of access do they have to those sorts of platforms and interventions?
So I think it's two levels of complications here, right? It's the assumption first that they even have access to a computer or Wi-Fi. And I think some cities in the world, in the US, are doing better than others on this. For example, Chicago has given access to most inner city youth Wi-Fi this summer so that they could actually learn things. And so that's remarkable. I know Connecticut's trying to do something similar. So I think first is making sure that we are all supporting our communities so they can have access to be able to even learn something. Now the second layer is, how do we design something that's online, that's culturally sensitive, that it's in different languages and reaches different socioeconomic status? And so for us, what we did is we took CBT and it really digested it and separated on thoughts, emotions, and behaviors. So instead of calling it CBT, we're calling thoughts, emotions, and behaviors. And we made the skills very easy. And so the course will have about 17 lectures. We'll start with like one skill, separating thoughts, emotions, and behaviors. It'll be a 8-minute like TED Talk kind of science, and then actors interaction and learning how to do this. And it's catered to everyone. So we have examples of a paramedic who is a Latino and is having trouble maintaining his job and being anxious, a single mother. And so we're really trying to digest it so it can be uptaked. And then we're also going to dub in different languages to increase access. And that's our efforts to sort of reach our communities.
Hey, Luana, thank you so much. Maurizio, a question for you that came in sort of related, because there's been a discussion about sort of prevention and things that we're doing to support frontline workers. But there was a question about what is MGH psychiatry doing with respect to how we interact with our colleagues, our medical colleagues within the institution. And someone wrote in both with respect to the inpatient service and actually this is from a leadership council member who knows about our relationship with medicine and surgical services in terms of how we support them on the consultation liaison service. Could you just speak a little bit about that?
Yeah, well, thank you, Lee, and thank you to the council member. It's a great question. You know, we've always had a tremendous tradition of interface with medicine. You know, we have a division of psychiatry and medicine, and Felicia Smith, who leads that division, really has kind of put together an incredible response to COVID-19 by having our docs interacting with the frontline workers, with patients, admitted to the medical wards, and we've seen instances like where COVID-19 as a virus has been able to penetrate into the brain and cause confusion, delirium, not knowing where someone is, and having the tremendous expertise of our psychiatrists that can recognize delirium or can recognize the cognitive side effects of this viral infection has been absolutely critical. They've really helped with the management of patients, keeping them safe. Because one of the things that if you become delirious is you don't know what you're doing, right? You can take away masks or the oxygen, or your life can be at risk. And so having that interface, I think, is really being critical. Great question.
Hey, Maurizio, thanks so much. Jean, back to you. Another question that came up. Another group of of interest, obviously, and who really, I think, require special attention during this experience has been children with special needs. And one of the members wrote in, is there sort of a way of thinking about approaching talking about the pandemic and talking about the things that are coming up, particularly with children who have special needs? I know that special needs is generic, but could you just sort of run with that a little bit and talk about the spectrum of patients that might be included there?
Yeah, I think the first point of that is parents are the best experts on their kids, and whether the kid has autistic spectrum is on the autistic spectrum, or whether a kid has some learning disabilities or problems with processing speed, the ability to take in information. I think we have to tailor the explanations to the kid, understand what their strengths and weaknesses are, and help explain things in ways that they can learn them. We also can coach them. I mean, one of the things that our department is so strong in is that we have plenty of psychologists and psychiatrists who are developmentally astute, and we're always available to provide a curbside consult to anyone to say, how can I express to this child? The first thing, though, is most of these parents really do understand how they explain other things. So, for example, what I'd say to them is, if you were going to explain a hurricane or a tragic event or a terrorist activity that you've heard about, or some hardship in the neighborhood, or some illness in the family, how would you do that? And then try to help them use that as an analogy to explain something like this viral illness. So most parents really have done this before. They just haven't done it with this kind of an extreme novel situation, but they probably have the tools to be able to make that translation.
Hey, thanks so much, Jean. Another question came in, and it's such a critical one, which is the number. The question was, how are we dealing? I'll put this out to anybody. How are we dealing as a department, as clinicians, with patients or friends and colleagues who have elderly patients with dementia and who are in assisted living programs, and how are people sort of managing that themselves, and also how are they managing it with these folks who are suffering from either dementia or related disorders? I'll put that to anybody on the panel.
Well, that's a great question, and I think that I think that has been one of the most challenging aspects, is that the elderly with dementia often are in situations where there are a lot of precautions and visitors are not allowed. In fact, one of the tragic aspects of COVID-19 has been that people who have died of COVID-19 could not be visited by relatives, and the trauma of the loss of a loved one without being able to be there for them. So that is clearly a big problem. I'm hoping that that by using some of the digital things that Jordan has compiled, some of these places where elders with dementia are situated and live, can access remotely these tools and hopefully help them feel better in an assisted living situation. Jordan, what do you think?
Yeah, I agree. It's a real it's such a multifaceted challenge. I think you're right that for caregivers, accessing tools can be helpful. For the individuals, just in terms of how to connect to their family members, the barriers that are up and the worries that people have of elderly folks who are in assisted living facilities and so on. is a problem that I think, you know, it goes even beyond anything that we can do at the level of, you know, disseminating the information and so on. So that's something that requires, I think, an institutional and, you know, medical response. But I think this is a real tragedy. I think it's a real tragedy to, you know, the added stress in those situations is just extraordinary on top. And so having, you know, certainly having digital availability to help with caregivers, having, maintaining contact with clinicians that have been available. We have a program in our department for geriatric psychiatry with lots of expertise in managing difficult situations like this. No easy answers, I think, at this point.
Thanks, Jordan. You know, as I think about the last hour and 15 minutes or so, I'm inspired by what we did out of the gate. I'm inspired by what we're doing. And even as the last question, we have a lot of work ahead of us, but I'm confident that we're going to get there to try to mitigate the effects of this pandemic and this experience on patients, regardless wherever we find them, and regardless of the particular issue that they're having. I want to thank my colleagues, and I want to be respectful of the time, and so grateful again that people joined us on a Friday afternoon of Memorial Day weekend. I want to thank my colleagues for participating. I would just wish that people stay safe, that they stay healthy, and please join us for the next series that we have, the Visiting Day series, which will be on June 4th at 4 p.m. And thank you so much for joining us. Have a good evening.
Thank you.